morning, ladies and gentlemen. On behalf of the Board of Directors and the Vetting Committee, we would like to express our thanks and appreciation to His Excellency President Joseph Jonas Boakai for allowing us to go through the exercise of recruiting, vetting, and submitting highly qualified candidates to his office for appointment to the positions of Director General and Deputy Director General for Administration as enshrined in the Act establishing the National Public Health Institute of Liberia, NPHIL. After a rigorous vetting and interview process, 3 names of highly qualified candidates were submitted to the President for both positions. Ladies and gentlemen, the President has selected Dr. Dubé Christian, NPHIL's new Director General, and Dr. Adam Lincoln as NPHIL's new Deputy Director General for Administration. Both Dr. Yan and Dr. Lincoln bring vast experience in public health administration, research, and medicine. Their appointments represent the President's commitment to improving Liberia's public health sector and restoring confidence among regional and international partners. The Board would like to extend its thanks and appreciation to the acting administration and senior management team of NPHIL for the impressive job done during this period of transition. And we look forward to their continued support to NPHIL's new leadership and Board of Directors. The leadership of NPHIL can be assured of the Board's support and effective oversight. We will collaboratively work with them, our partners, and the sector lead, the Ministry of Health, to truly build a center of excellence that the people of Liberia can be proud of. Once again, on behalf of NPHIL's Board of Directors, welcome and thank you all for your service to the Liberian people. Thank you.
I think the chair of the vetting committee will be very glad with that. That was a very competitive vetting process. Thank you. We move on to the next part of our program, and that is the turning over ceremony, the official transfer of power from the interim leadership headed by Mr. Amos Bori, Acting Director General, to the incoming leadership. The executive address, please. So let's say address or address.
The National Public Health Institute induction ceremony of taking started. So we share our life to our groups.
Dr. Stephen Kennedy, Chairman of the Board of Directors of NPHIL, esteemed partners and donors, Dr. Dubé Christian, newly appointed NPHIL Director General, NPHIL Senior Managers and Program Directors, ladies and gentlemen. It is a great honor to have you all here today as we gather here to turn over the mantle of leadership of the National Public Health Institute of Liberia entrusted to us in the past 2 months. Today's event is a historic one as it symbolizes institutional strengthening and sustainability of investments and approaches implemented by successive leadership over the years. Let me use this opportunity to appreciate the Board of Directors of NPHIL through its illustrious Chairman, Stephen Kennedy, who has brought effectiveness and quality of service to NPHIL in the past few months. This Board of Directors is one that has demonstrated leadership and tenacity in ensuring that NPHIL is rebranded in order to gain its respect among public health professionals at the national, regional, continental, and global levels. Ladies and gentlemen, during the transitional period, the interim management team made several strides to keep the institute operational, and such progress include the conduct of a planning workshop to set up a regional centers of excellence at NPHIL following an assessment conducted on several national public institutes in Africa by the Africa CDC. This achievement is one that NPHIL's partners and staff members are proud of and should be celebrated by all. Ladies and gentlemen, A detailed report on the current status of MPhil has been documented. Page 10 note to be submitted to the incoming leadership to guide the leadership in steering the affairs of the Institute. Finally, to the newly appointed Director General, Dr. Yang, and Deputy Director General of Administration, Dr. Lincoln, let me congratulate you both for your appointment and also inform you that the MPhil family is excited to have you both join us following a thorough vetting process at which time both of you emerged as the best candidates for the two positions. As was observed during the onboarding process at which time staff members were interacted with, the staff are zealous to support you in implementing your vision in taking MPhil to another level, building on gains made in the past. Once again, congratulations, thank you, and God bless MPhil.
Thank you very much. So we'll do a symbolic takeover. Will you all please stand? Distinguished media police, get your camera set, power is being transferred, you give the MPhil Act.
Again, on behalf of the MPhil senior managers and director, this is the first time a turnover ceremony is done at the Institute. We are very proud of this moment. Dr. Yang, we know you for the past 1 week. Those of us who have not met you before, we met you and we know you. Now we feel very proud of you that you are now joining the family. Dr. Lincoln, I know you very well in the past, and seeing you join us is a moment of joy. On this note, I would like to say on behalf of the SMT, we call it SMT for short, Senior Management Team. Maybe the SMT can stand right behind me so that this camera note is not me as Acting Director General, but the entire SMT is our note on the proceedings at MPhil during the past that details everything in the Institute, the current status, the challenges, the progress, the opportunities that exist. I do take this time on behalf of the SMT and the directors of the different programs to hand this note to you in the name of the Father, the Son, and the Holy Spirit. Thank you and God bless you.
So, that
You will all
has
see the shoes.
as the director of the National Public Health Institute of Liberia. We have going director just turn over the mantle of authority to Dr. Dupe Grace Nya, Managing Director General of the National Public Institute of Liberia. So, keep following Terra on
Thank you very much.
and
We'd
please
like
share our
to
live broadcast.
recognize the Special Assistant to the Honorable Minister of Justice and Attorney General of the Republic of Liberia, Mr. Siafa Kemoka, who just walked in. You are welcome, sir. We'd also like to recognize Dr. Musa from the African CAC. You are welcome. And so we move on. Now that power has been transferred to Dr. Dubek Chris Young, Director General of the National Public Health Institute of Liberia, Dr. Yang will now make a special statement. Let us be with us again, Dr. Yang. You're welcome.
So, here comes the Managing Director, Dr. Dubek Young, who is going to make his official statement here at the induction ceremony.
Oh, sorry.
So it was a mistake. So
we are going to join what happened.
Deputy Director.
Sorry, I'm very sorry.
It was an error of
So,
So
we will not
instead
give
of
the
Dr.
opportunity
Nyasu
to
again, Director,
Dr. Adam K. Lincoln, Deputy Director General for Administration. Dr. Lincoln will remain there and make a very impression on that. Dr. Lincoln,
So
please.
follow me.
Good morning. I beg your indulgence to allow me to sit and give my remarks because I'm just reporting from Seattle University. The chair and members of the infield board, a representative of the national government present at this program, representative of partner institutions, family members and friends, distinguished guests, ladies and gentlemen. Let me begin by expressing my profound gratitude to the President of the Republic of Liberia for the opportunity given me to use my skills, experience, and passion to deliver, to contribute in a very special way to the Liberia's healthcare system. I want to thank all those who have been working with MPhil to keep the institution going amidst the challenges. A special thank you to the team that has worked tirelessly, even over the weekend, to beautify this environment in preparation for the induction ceremony. Now, what do I bring to this position? I come to this position with more than 15 years of work experience in senior management position in both the private and public sector, nationally and internationally. I come to this position with documented history of successfully holding leadership positions in the health sector. I come to this position with an in-depth understanding of the Liberian health sector and operating environment. I come to this position without any personal or competing agenda, but to support the Director General in his quest to rebrand MPhil and make it more responsive to the needs of the Liberian populace. I will work with the Director General to ensure that MPhil is a highly professional environment characterized by mutual respect, fairness, accountability, teamwork, and commitment to delivery. Now, a lot of people have been asking, who is Dr. Adams Lincoln? Dr. Adams Lincoln is a person who's very task-oriented and wants to see things done on time. Dr. Adams Lincoln has zero tolerance for underperformance and is always willing to work with younger professionals to prepare them for future challenges and also future leadership positions. Dr. Adams Lincoln does not believe in gossip, but he encourages team members to have discussion with him based on their own innovation regarding the way to move MPhil forward. Let me call on all the staff members of the family of MPhil to work together with Dr. Dubert Christian, the Director General, to ensure that MPhil move forward and that MPhil has this appropriate position in the Liberian health sector. I thank you.
Thank you very much, Dr. Adam Lincoln, for that sweet and powerful remark. We now move on to the big one. And that is a special statement by Dr. Dubert Christian, Director General, National Public Health Institute of Liberia. DG will come on the floor so the board can see it.
So it is standard.
I will please stand and give the DG a standing ovation.
Good morning, everyone. Let us remain standing at a moment for silence for those who came before us, those who left this world due to the very epidemics that we have had over the years. Thank you. Will you please be seated? Dr. Stephen Kennedy, Chairman of the Board of Directors of the National Public Health Institute of Liberia, Mr. Walter T. Bonigal Jr., Chairman of the Vetting Committee of the NPA Board, members of the NPA Board, the current transitional leadership headed by Amos that have just transitioned the mantle of leadership to the new leadership. Mr. Members of the government present here, only member of government actually that I see are ranking is the Superintendent of River G County, Honorable Mike T. Swank, representing other government officials here. Dr. Adams Lincoln, Deputy Director General for Administration. The various partners present here, whom we've met just recently, the entire Enfield family, the team that put this program together, our family members who are present here and who are not present here, ladies and gentlemen. I'm elated to stand before you primarily to thank the President of the Republic of Liberia, His Excellency Joseph N. Boakai, for reposing such confidence in our leadership, and thanking in that respect the board and the vetting committee that went through an arduous process in ensuring that Enfield had new leadership based on the act and based on procedures that have been outlined here repeatedly. This imposes upon us the responsibility to ensure that what we do here will be in line with the Constitution of Liberia, will be in line with the responsibilities spelled out for Enfield by the Act. Our idea is to build or rejuvenate an Enfield that will be one of professional activities, an Enfield where integrity will be the order of the day, an Enfield where professionalism will be the bedrock of our relationship, an Enfield where transparency will also flourish, so that confidence is built not only by the people of this country, but by our partners who heavily support us with foreign earned resources at the point where our government may not be able to. That Enfield will not be a siphon for corruption. That Enfield will be that entity very respectively that will be deep down into all of our epidemiological responses and into the things of science and technology, that which we see in other countries. We would like to build an Enfield that will, for public health students to do their internship, so that those institutes remain the beacon from which we will tap our resources human-wise in order to build our pool of public health cadres. We envision to build an Enfield that will go diving deep down into the biomolecular sciences, so that we are not just providing data that only says a disease is existing here, a disease is existing there, but what happens afterwards. So in this respect, we do endeavor also to build that collaborative relationship with the Ministry of Health, which we have started already, respecting the mutuality and our common task to see that the the Liberian people, the region, and global health is given serious attention. In that respect, we will establish and continue interagency collaborations because there are functions that cut across agencies like the EPA, the FDA, the Food and Drug Administration, Forestry Development Administration Authority, and many other agencies, including the Liberia Medical Products and Regulatory Authority. So, Regulatory Authority. There are many acronyms that will come about, and I try to spell that out because of our international listening partners. Otherwise, we could just go through the acronyms and nobody will know what we're talking about. So thank you very much. We will also endeavor to build an atmosphere of peace, an atmosphere of mutual respect, and innovation. It is innovation and ideas that lead the world today in science, technology, research, medicine, and public health. And so we will try to encourage that so that we are not sitting idly and waiting for manna to fall down from heaven on our laps. And one particular institution that I would want to recognize that has done a lot of scientific work in this country, which goes undetected and unrecognized, is Africa Bio, which has left the Liberian borders and have created an ecosystem of excellence in science, technology, diagnostics in Africa, West Africa, and almost all of Africa now. During the COVID-19 pandemic, that entity extended its operations, in fact, outside of Africa, with people participating in diagnostics training. And I will recognize the Candice in that respect. It is very important because we all liaise with the WHO, APNet, CDC, NIH, Prevail, and these kind of collaborations will be built so that we don't operate in isolation. I thank you very much, and I want to thank the entire NFIL family for the warm reception that we have received over the last couple of days that we have been onboarded. It's been nothing but real warm-hearted welcome. I think from both ends, we all recognize the need to build on what has been erected here since the Ebola crisis, when we asked the U.S. government through our testimony at Congress and the efforts of the sitting government at the time to build us an institution, first in Liberia and around the region, then an African CDC, so that we will be able to respond to pandemics. Coming in, we have been baptized with the impending monkeypox outbreak, which we will talk about. We have spoken with our partners in our partners meeting, and we did reach some conceptualization as to how we move forward. And so we really want to thank you. We want to recognize, I mean not recognize everybody, but entities that we will be looking up to for philanthropic assistance to the NFIL, to the NFIL Foundation, like the HPX represented here by Erin King. He's right in the front of there. They have a very good, as I can describe it, good corporate social program that we think we'll be tapping into. So we want to wholeheartedly thank our partners that have stood the test of time to support the NFIL where our government's hand fell short. We want to assure you that we will be as transparent as ever with you, that we will be very collaborative in the work we do with each other, so that together we can build a resilient and robust public health system that will collaborate with the Ministry of Health, regional public health systems, to lead to global security in not just outbreaks, but diseases of interest that are in a non-communicable arena. Thank you very much, and we look forward to a very harmonious relationship, working relationship here. Thank you very much, and I appreciate it.
Machine
clap.
Director, as official director of National Public Institute of Liberia. So before turning on television, please share our live broadcast to
family members of
many
the
please
legal doctor official. Is there any member of the family here?
so no time for relax.
Maybe we can
Family
begin
members,
with
friends.
the Honorable Superintendent of the Review for the remark. Yeah.
So
an
we are
immediate
promised to
family
share
member.
with him which he comes
The captain
for
of the drama.
a brief remark here at the introduction ceremony of Enfield. Yes, shit.
Thank you very much. I bring greeting from the brothers and sisters, family from River County. We'd like to say thank you to everybody. Dr. Young is a great man. He's a man who believes in transparency. He's a hard-working man. One thing I like about him, doors are always open to everybody. So I'm asking every one of you to work with him. He's a great man. He's prepared to work and build this institution. So thank you very much, and I appreciate each and every one of you for working with me.
Is there any family member represented here from the Deputy Director of Administration? Okay. Let's give it a hand, please.
Right. So, on behalf of the family, we represent Dr. Adam Ego. We want to say a big thank you to the family. And with their experience coming to the job, we hope we're going to help to move this institution forward. Thank you.
Okay, so we now move to our partners. We'll be very brief. From this aspect, we begin with the happiness. Africa, epidemiology. They are the one training our epidemiologists that are in the field to get.
What if you don't want to bring it? It's going to already get I think that's all. Eddie.
Director of Affinet, Dr. Simon Antara, based in Uganda, and on behalf of the Affinet team in Nigeria, we'd like to welcome you and congratulate you, Big Sam. We're here to support you. We're here to make sure that Enfield becomes or continue to progress in the direction that you have laid out. Thank you. You're welcome, sir.
Thank you. And the partner of the African CDC.
Good morning, everyone. On behalf of the Director General of Africa CDC, Dr. Jen Kesaya, I want to firstly congratulate you on this very appointment. As the Continental Public Health Institute, we are in close collaboration with NQ, being one of the designated centers of excellence for National Public Health Institute in West African region. That is a platform through which we will be able to provide the needed support to NFU, as well as the DPR flagship initiative. That is also one area that Africa CDC is working in collaboration with WHO, Afro region, to support NFU in terms of emergency preparedness and response. So very soon you will also be hearing from us on the kind of support that we'll be providing for the Mpox outbreak that is ongoing in Africa. So we are happy to be here with you and to work closely with you. Thank you very much.
Thank you. USCDC.
Good morning, everyone. I want to congratulate Enfield and the new DG on this new position, this new leadership, new administration. So, on behalf of CDC,
the help of Andrew Brook, in itself representative in Liberia, I would like first of all to congratulate you, Mr. President, to congratulate the entire Enfield family. Yes, please keep being a family, and then you will succeed. Having a strong general is not enough to succeed. You need to have a family, a team behind. So this is my personal touch. Enfield is a part of UNICEF DNA. I will say why. Supporting Liberia to have a strong national public health institute is definitely one of the most relevant things to change the world for children. When we know how much children, mothers, and communities and families are paying as a huge price for public health crisis, and definitely Liberia is a land of reminding what means public health crisis. Yes, I'm not taking a risk to say UNICEF is committed to continue to support. Liberian government to continue to support and to success. Thank you.
Thank you, Africa Bow.
Thank you, everyone. My name is Candace Eastman. I'm the CEO of Africa Bio Enterprises. I've worked with many of you in this room, and it's truly an honor to be a part of this and to share in this welcome and celebration of the new leadership. I've worked with Chris Dubignon in other capacities. He sits on a board of ambassadors of West African scientists, some of the best. And I can tell you from the work that he does, not only in this region and beyond, that he's known for those who haven't worked for him or worked with him, you will find that all of those values that you saw up there that is representative of this institute is already in him. Ethics and integrity, transparency, accountability, equity, partnership, quality, productivity, and innovation. And you can be sure that's what you will get from him. And this is truly, he's truly a gem and valuable to this and all of us in Liberia. Thank you so much. And thank you, Dr. Lincoln, as well. I've worked with Dr. Lincoln through the Healthcare Federation of Liberia. He's been very impactful as well in the private sector. I just think that there's much to be celebrated here today. Thank you.
Thank you very much. So, Dr. Luke Bao from the LFHRA.
Okay, good morning, and thank you. So I will pronounce the entire acronym to you, Dr. It is the Liberia Medicines and Health Products Regulatory Authority. Thank you. So I've known the two gentlemen for a protracted period. I dare say close to in excess of 40 years. Dr. Yang, we were in undergraduate together, rough, raw, ambitious, and at the time, people in their team.
Showing your age.
Yeah, clearly. Roughly at that time, and then Dr. Adam Lincoln also, when I started my career in public health, he was the health team lead at UC, and we worked closely together, the level of collaboration that we had. So I want to remind all of us, and Dr. Young, you mentioned about rebranding. There are many institutions in Liberia that has to be rebranded, and we're already working towards it. The health sector, you may not have seen it, is fragmented. We need to bring it all together. We need agencies, the feeders of the ministry being the sectoral lead to all work together. Diseases are not the only health threats to Liberia. we have circulating in our territorial confines falsified substandard medicine, health product that will need to draw our attention. Currently, the LMHRA is in the process of safely disposing of over 600 tons of falsified and expired commodities. You, in your briefing note, I hope it is there. We are tapping on the MPhil to assist us in disposing of some of those commodities, given the capacity that the incinerating capacity that they have. You may also get to know in the very few days that we are at the tail end of approving a big pharmacovigilance project that tripartite implementation, the Minister of Health, MPhil, and the Liberia Medicine and Health Product Regulatory Authority. But all in all, there is a tax that needs to be done. It's huge, it's Herculean, but collectively we can surmount those challenges. I welcome you guys. I hope, I'm not saying hope, we will definitely do collaboration, not competitive. Thank you. Welcome.
Now, Mr. Henry King from HBX.
Good morning. Surprise, surprise. For many, many years, I've met him in the 1990s, and he is someone that I can say is of the utmost integrity and character. And I am sure that he will do very well at this institution. I congratulate you. As he mentioned, I am the country director for HBX. We're just getting started. We're in the, I would say, final stages of negotiating our concession agreement with the government. And so we look forward to working with entities such as yours as we develop robust CSR programs to support the good work that you do. Thank you very much.
Thank you very much. We also like to recognize someone very special for remark. And that person who I consider an old hand in the business, in the sector, former Chief Medical Officer of the Republic of Liberia, then a legislator, Dr. Mohammed Sharif.
Thank you very much for organizing this conference. We just want to say that. Welcome aboard. You have a lot of work to do. Congratulations. Thank you.
Thank you. Very, very lot of work to do. And so the Ministry of Health, is any representative of the Ministry of Health? Okay. So on this note, now we call on the Board of Directors for the National Premier Extension of Liberia. You got to touch one. Get it back to the chair. Let's pick from there. You do a lot of good when you tire for talk.
The first thing is good morning to everyone. I would like to, in this public manner, recognize the members of the board of directors that are present here today. We have Anthony Siafat Kemoka, member of the board of directors. Please give me a big hand. Next, we have Mr. Walter T. Gwenning Allen, chair of the Banking Committee, member of the board of directors. Next here, we have Professor Samuel Dopo, member of the board of directors. Okay, let's get back to business. I'd like to congratulate the new leadership, Dupe and Adams. Welcome. Like my colleague, whether he's counselor or doctor, I don't know which nomenclature to use, but I would say that the task ahead is enormous. Change, reform can be lot of patience, a lot of sacrifices, a lot of, moving away from your safe spaces at times. But if you believe in the goals and objectives for which this institution was established, there should be no reason why we should not do that. The institutions should take precedence over any one individual at any point in time. I'd like to say thanks to the transitional team, interim team, acting team, whatever nomenclature you would like to classify them. When we talk over after our preferment by the government of Liberia, it was a normal task to be able to change the culture within this institution. I'm proud today to sit here on behalf of the board to say that change is imminent. And that change commences with the interim leadership. So congratulations to this soul blaming guy, Amos. Congratulations to Mohammed, one of the hard-working person on the interim team. Well, I won't say interim team per se, but is the HR director. There were clashes, but eventually she got to realize where we were going and she felt a liar. So I just want to say congratulations to the team for being very supportive. To the partners, there's going to be a strategic approach. I will assume that the leadership will engage each of the partners individually and collaboratively or collectively. I will assume that the partners should also serve as good partners in progress. What do I actually mean? It may be a time that we may have to begin to assess capacity gap. Do we have too many? Are we oversaturated with surveillance officers? Are we oversaturated with global health specialists? Are we oversaturated with general public health specialists? Those are issues we may have to begin to revisit. If your funding stream from, say, for example, AfriNet is based on training surveillance officer, regardless of the term of reference, you can also look at the issues of molecular surveillance. You can look at the issue of molecular epidemiology. Those are also issues that fall within your context. I'm saying this that to be able to reform this institution, we have to ask ourselves several questions. Do we have the capability to conduct clinical trials? Do we have the capability to conduct clinical trials? Do we have the capability to conduct clinical trials for therapeutic, obvious drug is therapeutic agent or vaccine? It makes no sense. The common people in the market pay the taxes, and the taxes are used to sustain this institution. What is the value added for them? Like my colleague Luke just said, a lot of products are thrown on the market. Sean M will be the ideal institution to begin to assess these products in collaboration with LMHRA to determine whether those products are of value to the Liberian public. And then inform the people in the market that malaria medicine you buy from X, Y, and Z is not appropriate, don't buy it. This medicine, if you take it, you have to take all the complete doses to be able to work. I don't know what they call type of fever, but the wider tests that people are running around here has become a commercial business. This is something that the institution can reassess to determine whether we need PCR-related diagnostic to be able to determine whether those things that are being called typhoid are actually tied for fever. Fever, obviously, it has become a commercial business in this country. How can the little people, almost every clinic you go to, people are lying down, drip on their arm, they're receiving something, I don't know what they call sepro, but they're receiving something they say for typhoid. If you ever, at this institution, to be able to assess and analyze those things, the little people who sell, our parents who sell in the market, our parents who walk up and down the street, to give this information to them, that's what I'm calling value added. That's one. The next thing is we should begin to look at the National Reference Lab. Biosecurity, biosafety should become the norm of that institution. Smart Liberians at the institution. We should be doing sequencing here, genomic mapping. You have lots of people here. We don't even do mapping in Liberia to know what are the strains and what are the mapping of those strains. And we're one of the highly incident country for lots of people in the South region. Plasmodium, the plasmodium is a abundant, okay? One of the major killer. Can we begin to assess that at the molecular level to better understand that? And I'm throwing these things out to say that there should be value added from this institution to the common people. Until you can do that, we've got a long way to go. I must say thanks to the board of directors. They've been quite stringent in terms of revisiting the vision for which this institution was established. The board of directors is making history. From my recollection, it came from the incident management system. We had control of the research payload at the incident management system. Ebola vaccine has been licensed. Liberia play a critical role. What decisions do we have in the manufacture and distribution of that? Zero. Hepatitis vaccine. The former Liberian Institute for Biomedical Research plays a significant role in that. What control do we have? Nothing. River blindness, the clinical trial for the drug we use for river blindness, Liberian Institute for Biomedical Research. What control do we have? Zero. It's the time we become nationalistic, revisit some of these ideas, sit down and discuss with our partners how best we can revisit some of the objectives for which they're here, so we can collaboratively work together as partners. And that is what the board of directors has been trying to do. The first time in the institution history that you had a very functional board of directors. The first time in the institution history that you had in less than a year, you have more board of director meetings than you had in the past 6 years. First time in the institutional history that you have gone through a rigorous, transparent recruitment process. Institution, you have had a week-long onboarding process. First time in the history of the institution, we have a peaceful transition from one leadership to another. These things are opening out the horizon for greater things to come in the institution. The biggest assets here is the people that work for the institution. These are the biggest assets. We have to begin to rethink, retrain. People have to get out of the safe zone and begin to look at the institution as a global entity. Take ownership and move up to the next level. Our tenure expires in 3 years. I hope not to be back here hope that as the board, all basic benchmark that we have established to get you from here to 3 years from now, we will have achieved that before our tenure expire or before some of us retire. So I'd like to end here to say thanks to the partners. You've been very supportive. We are now going to sit at the table as partners, not as big brother and small brother, as partners to begin to rediscuss, reprioritize as to how we move forward. We are open for you to even take some of your staff and bring them here. We have spaces. Bring them in. If they have to sit in the finance unit, we open to that. If you want to open a lab where you control at the Liberia Institute for Biomedical Research, we open to that. The more you become actively engaged, the more you become actively involved, it creates confidence. And that is one of the issues we need to strengthen at this institution. We have an unfinished building. We have resources moving back and forth. We have to strengthen those. And lastly, we have to be in this position to apply for grants. That should be one of the barebone of this institution. Some of us have been around for 6 to 12 years. We never worked for government. We make good salary and we survive because we write grants. Institution like this, that is a think tank, I'm disappointed that almost all the funding you get here, I give unto you. We have to reorientate the mind. Got many terminal degrees folks here, but she got to work. So prioritize each unit, prioritize, set milestones, go after those milestones, revisit those milestones, doing short, middle, and long term. Where you fail, you recalibrate and start working on that. So I just want to say thanks to the staff that are here. We look forward to collaboratively working with you. We can assure you that the current leadership, we have our unflinching, unwavering, unconditional support.
Thank you.
Bad resistance to change. Try to work with us to better this institution. Like someone said, this is not the time for too much talking. Let's get away from gossip. Let's be more professional. He said it, the idle mind is problematic. Let's get away from that. Some of us were trained in the U.S. where if for any reason you're given a tax for about 6 hours and you complete the tax in 3 hours, you move back to, if you cannot come up with an idea for the next 3 hours, you move back to your post, I'm done. Is there something else I can do? Can I work on another committee? Can I work on another division? That's the kind of mentality we want to develop here. The board is very steadfast in getting you to that level. So on behalf of the board, my colleagues, that have been quite supportive, I'd like to say congratulations to Dupe and Islands. I'd like to say thanks to the brain behind the institution. I got amazed when I got here this morning and saw these things. In the past, maybe 6 years I've been passing around here, I've never seen something like this. So that's a symbol we're here in some way. And I'm confident with the support of the board, we will get there. Thank you very much.
Thank you, Dr. Kennedy. And so, Dr. Kennedy, with your indulgence, I'm sure you don't want to be held in contempt as a member of the Liberia Medical and Dental Council. So with the LMDC, the time to make a remark.
Chairperson of the Liberia Medical and Dental Council. So the Liberia Medical and Dental Council is the umbrella body of health in this country that supervises the regulation of all the health authorities in this country. So we are glad to be here. We know the team, particularly the Director
General, Dr. Yang, the Deputy Director General of Administration, Dr. Libo. They are personal friends of ours and we know their capacity to trust and we do bold and magnificent. So once more, on behalf of LMDC, we say thank you very much and we're here to continue to partner with you to make sure that your plans come to fruition. Thank you very much.
Thank you, LMDC. And so we are about to end. We'll call on our hard-working Director of Human Resource, Siaka L. Gray, who will do for us a vote of thanks. Let's give our hand, please.
So here comes the human resource officer. Yeah, I feel.
Please allow me to stand for the assistant officers. A very good afternoon. As we embark on a new phase of Enfield's wage, it is an honor to extend heartfelt thanks and appreciation to all of you here today. First and foremost, thank you to our Board of Directors for your strategic oversight and unwavering support. You have been our compass, guiding us in the right direction over this period, and we look forward to your continued wisdom as we navigate the future. Deep gratitude to our outgoing acting Director General, Mr. Amos Buri, and the entire senior management team, particularly Mr. Kaidi, Mr. Oya, and I wouldn't think myself. For your dedicated leadership during this transition, you have been our skilled navigators, keeping us on course through these challenging times. To our incoming Director General and Deputy Director General for Administration, Drs. Young and Lincoln, thank you for stepping up as our new captain. We trust that your vision will lead us to new horizons of success, and we are confident that under your leadership, Enfield will continue to excel in its mission to protect the public health of Liberia. To our partners and stakeholders, your support has been the wind in our sails, propelling us forward. We value your collaboration and look forward to continuing our journey with you. Special thanks to the organizing committee and all in this ceremony, a memorable one. The divisions of finance, procurement, logistics, ICT, the facility management team, the HR division, and all of you, our vendors, who have worked till the last minute just to ensure that we have this successful event. And a big thank you to the entire Enfield team for your resilience, adaptability, and commitment. You are the engine that drives our success. And as Henry Ford once said, take my factories, burn up my buildings, but gave my people back to me, and I will build the business right back again. Dr. Young, Enfield, the power of Enfield lies in its people. And the Division of Human Resources is committed to fostering a work environment that promotes collaboration, growth, and excellence. Once again, thank you all for being here today. Together, we will continue to safeguard the health of the people we serve and sail to the shores of success. Thank you.
Thank you, HR, for the vote of thanks. Quickly, for the announcement, I would like refreshment after the program. And so, I think you're going to please stand for the prayer of the national anthem.
So it's time.
Thank you very much. Wish you well for the rest of
So
the day.
thanks for watching. This has come to an end of the induction ceremony here at the National Public Institute of Europe. For return on television, let's go back to